As a physical therapist, one of the most common questions I get asked about hip replacement and hip osteoarthritis is, can exercise actually prevent hip surgery? So, the answer to that question is going to be a very unpopular one, and that is, it depends. Now, before we get into what it depends on specifically, I'll say right off the bat that in my previous experience, I've had patients who were able to get physical therapy. We do corrective exercise where we focus on strengthening their the deficits in specific muscle groups of their hip, and also maybe some muscle imbalances, muscle length limitations that once we worked on that, they didn't need to have surgery for their hip, and they were either able to be pain-free or very minimal pain and return to their physical activity that they typically do. And I've had patients on the other end where the physical therapy and exercise that we worked on was more prehab in nature, meaning it was just to get them strong enough going into surgery that once they got out of surgery, they were functional, right? So they can just get in and out of a wheelchair, in and out the bed without being super weak or requiring too much physical assistance from someone else, right? So now what it depends on in terms of can exercise actually prevent someone from needing a hip replacement? So it depends on how severe the arthritis is at that joint. So for example, in more moderate and severe cases of arthritis in the hip, you might have a lot more joint space narrowing where it's very bone on bone. There's not a lot of space for that head of the femur to move as you move your leg and your hip. So if there's very minimal space, then typically, exercise is not going to make the biggest difference, because structurally and anatomically, if your joint space is non-existent or essentially it's bone on bone, then there are some manual techniques that may give you a little bit of pain relief, but for the most part that has to be changed because it's more structural. Or if there's significant osteophytes or a lot like bone spurs, so the surfaces of the joint, like whether that's the femur or the socket portion of your hip, if there's like malformation of the bony structures, or there's just so much wear and tear that their surfaces are no longer smooth, and as they move along each other there's a lot of grinding. If it's to the point where it's moderate and very severe arthritis, then at that point it's going to be, like I said with that one example, more prehab in nature, where exercise is just to get you strong enough so that you can function after the surgery. But I've seen cases where it was either like minimal to moderate, very almost like light arthritis in terms of there wasn't too much wear and tear, but there was enough that it showed up on image that there were some degenerative changes, so it wasn't very smooth surfaces. But with the more minimal arthritis, or maybe even to low to moderate arthritis, you can get away with working on certain strengthening, flexibility, and mobility exercises, and obviously working on not only muscles and structures at the hip, but also at the trunk to make sure that you're not compensating and putting excess pressure on that affected side. So big answer to the question is, it depends on how severe your arthritis is. If it's on the lower end, yeah, you can prevent having to have surgery. If it's on the more severe end, then typically exercise is going to be more prehab in nature, where you're just trying to get you functional enough so that you have a more optimal and better recovery after the surgery. If you've been struggling with hip pain and have been debating whether or not to have hip replacement surgery, watch this next video as I talk about the typical criteria that we look at when debating when should you have a hip replacement surgery and when you should just focus on physical therapy.